Good morning, good afternoon, everyone. Good evening, actually, everyone. This is your favorite president, Dominique Powell. No, I'm welcome everybody for joining us today to a very important information meeting that I felt we all need to be a part of. Whether we was actually down at the World Trade Center or we worked in Staten Island or New Jersey, it might also be good information to share with your family. So today I want to get straight to the point, and I want to today you will be hearing from two programs: the World Trade Health Center program, and you'll also be hearing from the 9/11 Victim Compensation Fund. So without further ado, I'm going to turn it over to the team with Mount Sinai. And thank you. I want to thank you all for giving us this opportunity to be a part of this experience. Thank you for putting probation on the map, because a lot of people did not know who we are. And thank you for embracing us and being a part of your family. So I'm going to let it go.
Thank you, President Dalvani. Thank you, the United Probation Officers Association Union, for giving us this opportunity to meet with you today and talk about the two very important programs, the World Trade Center Health Program and the September 11 Victims Compensation Fund. My name is Agata Bednarska. I am the Outreach and Education Manager from the Mount Sinai Selikoff Center for Occupational Health. We are one of the 8 clinical centers under the World Trade Center Health Program that provides care to 9/11 workers and volunteers. So I'm here today to briefly speak to you about the World Trade Center Health Program, provide a brief overview as to who we are, what services we offer, what's the eligibility and application process to get into the World Trade Center Health Program, briefly talk about the clinical centers of excellence, where are they located, and provide you with the contact information. So just to get us started, what is the World Trade Center Health Program? The World Trade Center Health Program is essentially a federally funded program. It's administered by NIOSH, National Institute for Occupational Safety and Health, within CDC. We offer quality comprehensive medical care to those who are directly impacted by the September 11 attacks. And that includes the 9/11 workers and volunteers defined by the law as general responders, and individuals who lived, worked, or went to school in the area, defined by the law as survivors. So just a little bit of background on the World Trade Center Health Program. The World Trade, back in 2011, Congress passed what's called the James Ojoga Health and Compensation Act of 2010, and it established the World Trade Center Health Program and the September 11 Victim Compensation Fund that my colleagues will soon talk more about. In 2015, the program was reauthorized for 75 years. So we're up until we were reauthorized up until 2090 to provide care to general responders and survivors. One of the things that we want you to remember, the World Trade Center Health Program is not the same as the World Trade Center Health Registry. The World Trade Center Health Registry was sort of a New York City registry and a database that the New York City put together to sort of assess how many people were affected by 9/11. They were sending out surveys, but they're not providing any medical care, or they don't provide any compensation. And we're not the same as September 11 Victim Compensation Fund, which again, my colleagues right after this presentation will talk about what is the September 11 Victim Compensation Fund, called VCF. So as far as the services offered through the World Trade Center Health Program, the services, as I mentioned, are offered to general responders and survivors. We offer annual medical monitoring exams for general responders and initial health evaluations for survivors. Essentially, the core concept of those medical monitoring exams is the focus is really on the diagnosis and the management of World Trade Center related medical and mental health conditions. You come in, you complete your blood, urine tests, chest x-rays if needed, breathing, and counseling. To those who have certified conditions, and I'll talk very briefly about what does it mean to have a certified condition, but for those who have certified 9/11 related health conditions, we offer treatment. So the treatment essentially focuses on care coordination and treatment of that specific condition. And that includes medical tests, referrals to specialists, surgeries, prescriptions, essentially anything that you need to treat that specific 9/11 condition. The program is set up to offer cancer screenings, which is a really important service, and we offer lung, colon, cervical, and breast cancer to those who are eligible. We offer benefits counseling, so the team of social workers work with our patients to determine, what are the benefits as a 9/11 responder you may be eligible for. And last but not least, very important and highly confidential, mental health services are also offered through the World Trade Center Health Program. And these are done whether through an individual counseling or group sessions. All services are available at no out-of-pocket cost for general responders and survivors involved in the World Trade Center Health Program. So I mentioned briefly that the treatment for 9/11 related conditions is available to those with certified 9/11 health condition. Very often, if you're part of the World Trade Center Health Program, or you hear that, or even if you're not, but you probably heard that word, certifications, or I need to get certified. So what is certification? What does it mean to be certified? It's through the World Trade Center Health Program. Essentially, certification is an attestation to the fact that your 9/11 health-related condition that your health condition is in fact related to your exposure at 9/11. So the World Trade Center Health Program, again, administered by NIOSH, will pay for all of your medical necessary treatment for all certified conditions only if your health condition is included on the current list of World Trade Center related health conditions. And right after this presentation, I'll put in a chat the list of all of these conditions so you guys can take a look. B, your 9/11 exposures are substantially likely to have been a significant factor in either aggravating, contributing to, or causing that health condition. And your health conditions and your 9/11 exposure meet the World Trade Center Health Program policies and criteria for certification, such as maximum time intervals and minimum latency requirements. So when you come in through the World Trade Center Health Program and you complete your medical monitoring evaluation, your physician will determine whether or not you have a condition that meets all of those requirements. And if they do determine that you have a condition that is on the list of currently approved conditions, that condition is caused by your 9/11 exposure and you work at the ground zero location, what they do is they take all of your paperwork, your medical paperwork, they send it back to NIOSH, again, our funding agency, and they ask them and they request NIOSH to recognize your condition as 9/11 related. Once NIOSH receives that sort of medical package, they review that and they determine and decide whether or not your condition is in fact related to 9/11. If it is, and again, it meets all of the criteria that are set up by the program to meet certain eligibility criteria for conditions, they will certify your condition. And with that certification, again, if you have a condition that is certified by NIOSH, the federal government, treatment for that specific condition will be paid for by the program. So what conditions are covered by the World Trade Center Health Program? These are just general categories of conditions. And again, right after this presentation in the chat box, I will put a list of all of those conditions and we'll share that presentations with the president. So it will be available to you on your website or via email. But generally speaking, what we do see among 9/11 responders, and generally speaking, the conditions that are covered by the World Trade Center Health Program include airways and digestive disorders, one of the biggest categories, mental health conditions, musculoskeletal disorders, certain cancers are on the list of those conditions as well, and medically associated conditions, which is essentially any condition that is related to disease progression or complication from treatment of one of the conditions that are currently on the list and certified through the program. So as far as the World Trade Center Health Program eligibility and enrollment, as I mentioned, the World Trade Center Health Program is available to general responders and survivors. So who is the general responder? A general responder, as defined by this Georgia law, is any individual, worker, or volunteer who is involved in rescue, recovery, demolition, debris cleanup, and other support services. Worked for a minimum of 4 hours between 9/11 and 9/14 of 2001, or 24 hours between 9/11 and 9/30, so in the entire month of September, or a combination of 80 hours between 9/11 and 7/31 of 02. And they worked either at the World Trade Center disaster area, which is, you see the map on your right, it's south of Canal Street, Staten Island landfill, barge loading piers, or office of the chief medical examiner, handling human remains. The definition of a World Trade Center survivor is slightly different. In order to receive services, medical care through the World Trade Center Health Program as a survivor, you had to be either present in a dust or a dust cloud in New York City on 9/11. You either had to work, resided, or attended school or childcare, or went to work at that time down at a ground zero location and surrounding areas, or you worked as a cleanup worker or perform maintenance work in the New York City disaster area. And the New York City disaster area, as per eligibility criteria for survivors for the World Trade Center Health Program, again, it's a little bit different than for responders, and it includes south of Houston Street and 1.5 mile radius from the ground zero location into Brooklyn. And the map is in your right-hand corner. So very briefly, if you do think that you are eligible for the World Trade Center Health Program, we strongly encourage you to visit the CDC website, and it's www.cdc.gov/World Trade Center. We'll share that information in the slide again. Click on the Find Out How to Apply button, and you do see that screenshot where you can find this. Review the eligibility criteria for the World Trade Center general responders and survivors to determine if you qualify for one of those categories, and register. As part of the registration process, you will be required to submit a supporting documentation to complete your application. And the supporting documentation for the World Trade Center Health Program that you have to include the hours. So how many hours did you work? What was the location that you worked at the ground zero location? What was the specific location that you worked at that time, and the type of work that you did? So some of the samples of the supporting documentation that the World Trade Center Health Program is accepting include union letters, or the self-attestation letters, which is essentially a letter that you write out on your own, explaining to the World Trade Center Health Program, NIOSH, as to what you did, what type of work you were doing at the time of 9/11, when was it, and where, and what was your location, as well as letters from your coworkers attesting to the fact that they worked with you at that time doing X, Y, and Z work for X amount of time. You can complete your application and submit along with the supporting documentation through 3 different ways. So you can go online. Again, the website is included in point 1. And you can complete that application online, or you can print it and mail it, or you can, again, print it, mail it, and then fax it. So there are 3 different options on how you can submit that application. Here's just a list of the clinical centers of excellence for general responders. There are 8 clinical centers within New York, New Jersey metropolitan area that provide care to 9/11 workers and volunteers defined by the law as general responders. And we also have the nationwide network of providers who live outside of the New York metropolitan area, administered by LHI, Logistic Health Incorporated. And here's just a list for the survivors, the locations of the clinics, the survivors, again, individual who was in the area at that time, worked in the area, went to school in the area. Their care is administered, their World Trade Center Health Program care is administered through the New York City Health and Hospitals, so HHC hospitals, and the locations are listed in there as well. So the top key takeaways before I turn it over to my colleagues from the VCF is, again, the World Trade Center Health Program is not the same as the September 11 Victims Compensation Fund. It's not the same as the World Trade Center Health Registry. If you are registered for one program, it doesn't mean that you are automatically registered for the second program. So we strongly encourage you to make sure that you check the status of your World Trade Center Health Program application, of your World Trade Center Health Program. If you currently are enrolled in the World Trade Center Health Program and receiving care through one of the 8 clinical centers that I mentioned, we do ask that you stay up to date with all of your World Trade Center annual medical monitoring and treatment visits. It's extremely important that you take that time to come in on the annual basis, complete the medical monitoring and treatment visits, in addition to your regular, PCP appointments that you have. Connect with your CCE if you have any additional questions about your care or would like to schedule a follow-up appointment. Again, I'll put those, the list of those CCEs in the chat. And if you know of any 9/11 responders who are yet not enrolled, encourage them to enroll. It's really, the World Trade Center Health Program is still open. We do accept applications. There is no deadline to register for the World Trade Center Health Program, and it's extremely important to talk to your colleagues who did respond to 9/11 and are yet not enrolled in and are not receiving care through the program to get them enrolled. If you're not yet enrolled or you're not sure whether or not you're enrolled, we strongly encourage you to call NIOSH, the World Trade Center Health Program call center line at number that is provided in here to check the status and make sure, if you are enrolled, they will connect you with your CCE and then you'll follow up with the care. If you're not enrolled, again, review the eligibility criteria, click on the find out how to apply to determine if you do qualify, apply and register. And here are just the phone numbers. So the main phone number to the World Trade Center Health Program, NIOSH, is included. And then my colleagues from the Mount Sinai Circle Centers of Occupational Health, the World Trade Center Clinical Center, Maria Lugo is also available if you have any questions about enrollment applications or you're not sure whether or not you register. We can definitely help you out with this. And then with that, I'll turn it over to Anthony and Nicole.
Thank you, Agatha. Bear with me 1 second while I share my screen. Can you hear me okay? Okay, great. So good afternoon, everyone. Like Agatha said, my name is Nicole P. Smith. I'm the Associate Special Master with the September 11th Victim Compensation Fund. And I'm here with my colleague, Anthony Gardner. I want to begin by thanking President Delvany for the opportunity to join you and the members of the Probation Officers Association this afternoon. Anthony and I appreciate the opportunity to share more information about the VCF. We also want to thank our colleagues at Mount Sinai for facilitating this important forum. We know that everyone has been challenged by COVID-19 and our thoughts remain with those of you in the 9/11 community who have gone through a particularly hard struggle. We also want to thank all of the doctors and the staff at the World Trade Center Health Program clinics for their dedication to continuing to provide treatment and monitoring during COVID by always putting their patients first. And before we jump into the agenda, I do want to let you know that despite COVID-19, the VCF has managed to maintain full operations. We continue to review claims, issue eligibility decisions, and also awards. And our staff was able to quickly put in place and adopt a fully remote work setup. Now, most of our staff have never teleworked. And so the fact that we were able to do that so quickly and able to continue to get out award decisions is just a testament to how committed we are to this community. We do had two major changes to our operations as a result of COVID-19. First, it is taking us longer to process incoming mail. And so whenever possible, we encourage everyone to upload documents to our online system instead of mailing them in. And then second, we initially had stopped printing and mailing hard copy letters, but now we are actually back to mailing some letters on a periodic basis. But we do want to note that all of our letters are uploaded to our online claim system. And so anyone who doesn't have online access to their claim should call our helpline to get access. That way you can see whenever a letter is uploaded. And you can also get access to your claim even if you're working with an attorney. If you call our helpline, they'll help you out, okay? And so with that, we actually want to start with a quick poll just to see where everyone is, see how many of you have actually filed a claim with the VCF. So the question is, have you filed a claim with the VCF? Yes, no, or not sure? All right. So it looks like a few of you have filed a claim. Several of you have not filed a claim, and at least one of you are not sure. So we want to make sure that we get you all the information that you need if you have not filed your claim yet. And if you're not sure, we're going to provide our helpline phone number. Well, it's actually right there on the screen for you. You should call the helpline if you're not sure whether you filed a claim with the VCF, okay? And they will let you know whether we have a registration on file for you and also let you know where you are in the claims process, okay? So this is what we are planning to cover today. First, I'm going to start with a brief overview of the September 11th Victim Compensation Fund, or VCF. Then we'll discuss what it takes to be eligible for our program and provide a high-level explanation of how we calculate awards. Then I'm going to turn it over to Anthony, who will explain what we call the 3 basic steps. He will talk about registration, claim filing deadlines, and also how VCF claims are processed. Then I'll wrap it up with our top 5 takeaways and point you to some helpful resources before we open it up for questions, okay? So with that, let's jump into it. So what exactly is the VCF? The VCF is a compensation program. We provide compensation for individuals who are present at the World Trade Center or in the surrounding New York City exposure zone, at the Pentagon crash site, or at the Shanksville, Pennsylvania crash site at some point between September 11, 2001 and May 30th, 2002, and who have since been diagnosed with a 9/11 related physical illness. When we first reopened back in 2011, we were supposed to be open for a limited amount of time, and we had limited funding. But then in July of 2019, the Never Forget the Heroes, James Zadroga, Ray Pfeiffer, and Louis Alvarez permanent authorization of the September 11th Victim Compensation Fund Act was signed into law. It established the VCF as a permanent program, fully funded us to pay all eligible claims, and extended the claim filing deadline to October 1st, 2090. We do want to make it a point to let you know that the VCF is not just for first responders. There are other potential claimants that include workers or volunteers in construction, cleanup, and debris removal, people who lived, worked, went to school or daycare in the area. We also want to let you know that if there were folks in the area that went to adult daycare, they may also be eligible. So to give you an idea of where we stand with claim filings and awards, as of our last monthly report dated April 30th, 2021, we have received over 62,500 claims. We found nearly 39,000 claimants eligible for compensation, and we've sent award letters to over 37,500 of those individuals. The total amount awarded to date is just over $8.38 billion. We publish monthly statistics on our website that include additional details about the program. And so we encourage you to take a look at the statistics report, as well as our 2020 annual report, which we posted on our website in February. And so we want to know who is eligible. How can you join the over 62,500 people that have filed a claim? So to be eligible for compensation from the VCF, you must meet 3 requirements that apply to everyone. There are some additional requirements depending on your individual circumstances, but today I'm going to focus on the requirements that apply to everyone. So first, you must register with the VCF by July 29th, 2021, or by your applicable registration deadline. And Anthony is going to talk to you a little bit more in detail about this later on in the presentation. But I do want to note that there is a lot of erroneous information out there about our July 29th deadline, and we want to make sure we clarify that for you this afternoon. Second, you must be certified for treatment by the World Trade Center Health Program for a 9/11 related physical condition. We follow the health program. So if a condition is on their list and they certify you for the condition, we will accept it as eligible for compensation. We work closely with the health program and exchange information regarding conditions for which you are certified. So you do not need to submit any proof of certification or medical records for the purposes of showing that you have been certified. We'll get that information directly from the health program. And then third, you must show that you were present at a 9/11 crash site, including the World Trade Center, Pentagon, or Shanksville, Pennsylvania, or in what we call the New York City exposure zone at any time beginning on September 11th, 2001 through May 30th, 2002. That's when the official cleanup effort ended. We call this presence at site, and I'll talk about that in a little more detail in a moment. But first, let's talk about how you can prove your presence, because we know this is a topic that raises a lot of questions. So I mentioned the New York City exposure zone, and you'll see it illustrated in the shaded green in the image right there. So in order to be eligible for compensation, we need some type of proof that you were present in this shaded geographical area in Manhattan or along the routes of debris removal at any point, again, between September 11th, 2001 and May 30th, 2002. The VCF exposure zone used to establish presence runs south of Canal Street, river to river, and from the Hudson River to the intersection of Canal Street and East Broadway, north on East Broadway to Clinton Street, and east on Clinton Street to the East River, and any area related to or along the routes of debris removal, such as the barges or the Fresh Kills landfill on Staten Island. Now, this is a little different from the New York City disaster area used by the World Trade Center Health Program when they're evaluating your exposure. In addition, unlike the health program, we do not have a minimum time requirement for presence. You just need to show that you were in this area at some point during the relevant dates. And so we know that we're coming up on 20 years since 9/11. So another question that we get is, how do we prove presence all these years later? So we know this can be challenging, but proving that you were present at one of the 9/11 crash sites or in an area related to or along the routes of debris removal is a key requirement to be eligible for compensation. One of the ways that we have tried to ease this burden on you is by working with employers, unions, and other organizations to share information and identify available documents to support presence for their members, employees, or volunteers. And so some of the documents that can be used to support presence may include union documents or letters, employer letters, or VCF third-party verification forms. We also accept contemporaneous medical records from that time frame. And so for the UPOA members, you all should contact the union to discuss documents to help prove presence by email. You can email unitedprobation@gmail.com, or you can call 212-226-1069. Again, for those just listening on the phone, you can email the union at unitedprobation@gmail.com. That's UNITEDPROBATION or call area code 212-226-1069. Okay. So there is a complete list of various entities with whom we have relationships and documents that you may use to prove you were there. We have this information on our website underneath our policies and procedures. And one of Anthony's main responsibilities since joining the VCF is to work with additional organizations to establish these relationships. So we expect to continue to expand the list in the future. It's important to remember that we consider the totality of circumstances in each individual case, and we will consider a wide range of documents to support presence. And I also have a couple more comments about presence. So when we're determining which documents you should submit, you need to think about, what is the goal? Our goal is to receive independent documentation that shows where you were at the time, meaning specific addresses, or when you were there, meaning specific dates or time frame, and then also why you were there, meaning the activities you were doing. When it comes to location, we know that some of you may have worked in a particular building or at a specific address, but others of you may have worked all around the area, moving around continuously to do work at various locations. And so if you cannot provide a specific address, that's okay. You can use cross streets, you can indicate what block you were on, you can tell us about nearby landmarks, but just tell us what you remember about where you were located and provide as much detail as possible. And then, as I mentioned, we will accept a wide range of documents and encourage you not to just look at the list on our website, but to also think about where you were at the time, who you were with, and what you may have that shows you were there. If you have a document you believe could be used to prove your presence and it isn't on our published list, we encourage you to please submit it. We will review it and we will see if it meets our needs. And I want to make a note about affidavits. If you cannot find independent documentation, which is the best way to prove presence, the next best thing you can do is to have someone that saw you there or knows you were there submit a statement on your behalf, attesting to your presence. If you do get someone to submit a statement, we would like for you to use the VCF Witness Presence Statement form instead of an affidavit. We created this form because we were continuing to receive affidavits that lack the detail that we need. And so we created this form. It's on our website under forms and resources. And if the individual that you get to submit a statement on your behalf completes this form, we should have the level of detail that we need to evaluate your presence. Our website has a lot of information about how to prove presence, and it is a great resource. And we are working now to add a new how to prove presence page, which gives even more details about the documents you may use based on your individual circumstances. Again, we recognize that it can be difficult to find proof that you were there for a variety of reasons, including the passage of time. People have changed jobs, they're moved away, or you may have just lost touch with some of your colleagues or friends. So we definitely understand. If you are unable to get the documentation to support your presence and your claim is denied because of insufficient proof of presence, you will receive a decision letter that will include an appeal form and also instructions to appeal your decision. Please appeal if this should happen. A denial does not mean that we do not believe you were there. It simply means that we don't have the documentation that we need in order to confirm it. And so if you tried every possible way to find documents that prove your presence or people who can attest to it on your behalf, and you simply can't find what you need, the denial should be looked at as a door opening, not a door closing. It's actually an opportunity for you to come in and talk with us about your presence. It's another way to provide information in support of your claim. And if you appeal, we will schedule a hearing. The process is not adversarial. You can come in, tell your story, explain the circumstances for you being there. And it may be exactly what we need to confirm your presence. We get a question about presence a lot as far as when you should submit your presence documents. And I know some of you have already filed a claim. Some of you haven't filed a claim yet. You may be considering, how do I find this information and what do I do with it if I'm not ready to file a claim? So you should submit your documents to us when you find them. You don't have to submit them until you file your claim. But once you register in our online system and you have an account, you can actually upload your presence documentation to store it for future use. So if UPOA can help you secure presence documents, you can upload them now. The VCF, however, will not review them until you actually file your claim. So if you decide to upload your documents in order to store them with us, you need to be very careful that they actually confirm that the documents contain as much specific information as possible. You should review it in detail and make sure that it meets all of our requirements. If you're not sure how you would find documents to prove your presence, we encourage you to go ahead and think about them and start gathering them now. If you were there, even if you are not sick, if you know someone who can attest to you being there, you can ask them to complete the witness presence statement now to have it ready for when or if the time comes for you to actually file a claim. So we encourage you to look at the list on our website, think about what you have that can help you prove your presence, and go get it now, okay? And lastly, we have a quick tip. Now, Agatha talked about documents that you can use to submit to the health program. Those same documents that you submit to prove presence can be used with the VCF as long as it's within our date range of September 11, 2001 and May 30th, 2002, and actually put you in Manhattan below Canal Street or along the routes of debris removal or the Fresh Kills landfill or also the morgue. So if you can find documents to submit to the health program, a lot of times those same documents can actually be used with your VCF claim. Okay, so we've talked about eligibility. And before speaking for a moment about our awards, I also want to highlight very quickly some differences between the health program and the VCF. I know Agatha went through a couple of these differences, so there may be some information that you've already heard, but we just want to drive home the point because we've heard a lot that people don't understand that we are two separate programs. Enrolling or registering in one does not register or enroll you in the other. You may be certified for treatment by the health program, but not eligible for compensation by the VCF for a few reasons. And that is because the criteria for our two programs overlaps to some extent, but not entirely. So the illness is covered. The VCF only compensates for physical injuries or conditions. By statute or by law, we are not allowed to compensate for mental health conditions. The health program will certify and treat both physical and mental health conditions. But like I said, VCF can only compensate for your physical conditions. And as I explained a few minutes ago, our geographic zones are different. For VCF, presence at the site or the New York City exposure zone is south of Canal Street in Manhattan. It includes the routes of debris removal, the barges, the Fresh Kills landfill on Staten Island. But for exposure, the health program has a New York City disaster area. It is south of Houston, which is several blocks north of Canal Street, and they also go into parts of Brooklyn. Our timeframes are also different. Like I said, for VCF presence, we need to know you were there between September 11, 2001 and May 30, 2002. But the health program for exposure goes through July 31st, 2002. And then the length of time that you had to be there is different. For the VCF, we do not have a minimum time frame for presence. We just need to know you were there at some point. But the health program has minimum time requirements for exposure because they're looking for the connection between your exposure and your condition. And finally, one important note is that the VCF does not distinguish between responders and survivors. There's no difference in the application process. Eligibility requirements are the same, and we also calculate awards the same. I do have one last topic to cover before I turn it over to Anthony, and that is the formula that we use to calculate the awards. I know that's what you all have been waiting for. After all, we are a compensation program, right? So let's see. What does the VCF compensate for? So we compensate for two types of loss. The first is non-economic loss. That is what is commonly referred to as pain and suffering. These awards vary based on the severity of your condition and the impact of the condition on your daily activities. The amount of your non-economic loss is not tied to the number of conditions that you have certified. It is only based on the severity and the impact overall. Non-economic loss awards range from the low of $10,000 up to $340,000. And there are certain limits to these awards as set by laws that govern the VCF. All eligible claimants qualify for a non-economic loss award. If you meet the eligibility criteria I mentioned earlier, then you qualify for a non-economic loss award. The next type of compensation is economic loss. This is the value of wages or other employment benefits that you lost as a result of your eligible condition. In order to receive an economic loss award, you must have a disability due, at least in part, to your eligible 9/11 related condition from a governmental entity or a private insurer. In calculating economic loss, we consider your age, your income, your percentage of disability, your date of disability onset, and employer-provided benefits. When calculating awards, we are required by law to subtract what are called collateral offsets. These are payments you have received specifically because of your eligible condition. So for example, if you receive Social Security disability payments or workers' comp payments, or if you happen to settle a 9/11 related lawsuit or another lawsuit related to your eligible condition, we are required to subtract this amount of your settlements from your award. So the overall formula looks like this. It's non-economic loss plus economic loss less collateral offsets gives us your total award. It's important to note that all awards are individually calculated based on your unique circumstances. There is no cap to the total award an individual may receive, but we do have certain limits that are placed on inputs of the award as dictated by the laws or the statute that governs the VCF. And so I'm going to turn it over to Anthony, who's going to talk about registration and filing a claim.
Thank you, Nicole. Hello, everyone.
Okay.
Just give me a minute to pull up my slides. Well, again, everyone, I'm going to just quickly, actually, I'd like to back up here. This is one slide too far. Hang on one second. All right. Well, step one, in terms of the three basic steps, is to simply register. We're going to talk about that in greater detail in just a minute. Step two is to get certified by the health program for a physical health condition. And step three is to file your claim by October 1st, 2090. So these are what we call the three basic steps in the registration and claim filing process. So let's, sorry, my slides are not advancing for some reason. So let's start by talking about the registration process. Now, You could register either online via our website, by that link that you see there, or by calling our toll-free helpline. So there's different ways to register. Agata's mentioned and Nicole has mentioned that VCF and the health program are two separate programs, and it's really important to remember that. Enrollment and registration in one program doesn't automatically carry over into the other. Registration preserves your right to file a claim in the future, and you don't need to be sick to register. At the time of registration, you simply need to provide basic information. It's a very quick process, takes a few moments, and you just need, contact information, date of birth, social security number, or other ID at the time of registration. Now, registration is not the same as filing a claim. We're going to talk about that in a little bit of greater detail in just a moment. And the registration deadline is not the same for everyone. The registration deadline varies according to individual circumstances. Now, let's talk a little bit about filing a claim. So first off, you don't need an attorney to file a claim on your behalf. You're certainly welcome to work with one if you choose to do so, but you are not required to have an attorney to file a claim. Once you're certified for a physical health condition by the World Trade Center Health Program, at that point is when you're going to go ahead and complete and submit your claim. And these are some of the various documents that are required at that point. Now, I mentioned that the registration deadlines vary according to individual circumstances. The claim filing deadline, however, is the same for everyone, and that date is October 1st, 2090. Now, we have a number of resources on our website to help you navigate these 3 steps, and that is an image of our dedicated webpage, the How to File a Claim page on our website, vcf.gov. So I would definitely encourage you to visit this page. There's everything on here. There's a drill down with detail for each of the 3 steps, and there's helpful information, step-by-step guides, all there to help make the process easier for you. But again, if you ever through this process have any questions at all, please call our helpline. We're going to give you that number again at the end of the presentation. Now, we've talked about the July 29, 2021 registration deadline, so I just want to give you some background on this. Now, this is the deadline, is actually 2 dates from enactment of the permanent VCF Permanent Authorization Act that Nicole mentioned earlier. And essentially what this is it's a grace period that provides an opportunity for claimants who miss prior deadlines to register. You are only required to register with us by July 29th, 2021 if your only certifications with the health program for a physical health condition was done before July 29th, 2019. If you have not yet been certified by the health program, or if any condition is was certified after July 29th, 2019, you could certainly go ahead and register by the July 29th deadline, but you're not required to do so. As Nicole mentioned, there's certainly been a lot of confusion about this deadline and who it applies to. So I want to break this down in a little more detail here and just get to sort of the bottom line of this is really how you answer this question. Are you certified for treatment for a 9/11 related physical health condition? Depending on how you answer that is going to determine if this deadline applies to you. So if you answered yes, you have 2 years from the date of that certification to register with us. If you have more than one certification, it's 2 years from the date of the most recent certified physical health condition. If you answered no, your 2-year clock for registering with us has not even started yet. But again, as we've mentioned, go ahead and register now. Certainly, if you still have time, that's great, but go ahead and register, and then you wouldn't have to, worry about it in the future in terms of missing that deadline. And again, this July 29, 2021 deadline is essentially an opportunity for those who missed their prior deadlines to register. So if you have, if you're a person that falls into this category and you have a certified condition from before July 29, 2019, and you missed that earlier 2-year period to register with us, this deadline now gives you the opportunity to be grandfathered in if you missed that prior deadline. So in the future, if the health program certifies you for a physical health condition, you're required to register within 2 years of the latest date on which they certify you for that condition. So, a quick example is if you're certified for a physical health condition today, May 19th, 2021, then you have until May 19th, 2023 to register. So just keep that in mind. That 2-year period starts from that date of certification. But again, go ahead and register so you don't have to worry. We have detailed information on our website about the various registration deadlines, including information for those who are filing claims on behalf of an individual who's died as a result of a 9/11 related physical condition. And that's all available on our website, which is www.vcf.gov. So for those on the phone, vcf.gov is the website. So please visit the site and for more information. Now, the last topic I'm going to talk about is basically processing a VCF claim and give you a little bit more context on the process and the timeline. So claims are reviewed in priority order, and they're based on the date the claim form is submitted. So essentially, first in, first out order. Now, the time it takes for us to process your claim depends on many factors that you see there: the type of claim, the losses that are claimed, the complexity, and also whether or not you've been able to provide us with all the documentation we need to evaluate your claim. Now, you may appeal your claim within 30 days of the determination if your claim is denied, or if you believe that the award was erroneously calculated. We do have appeal hearings as the mechanism for that. So there are informal, they're non-adversarial. They're currently, because of the pandemic, being held by phone or video conference. So you'd have that ability. You may also amend your personal injury claim at any point before October 1st, 2090, which again is that claim filing deadline that applies to everyone. And at that point, you could add a new condition, claim a new loss, and or submit additional information that may be relevant in the evaluation of your claim. One important note is that certification of a new condition does not automatically mean a higher award, so please keep that in mind. And the last thing I just want to mention is, a common question that we get from people is, how long does it take to receive an award once you file a claim? So we have on our website, to help answer that question, a claim review timeline. And you can find that on our website. It's in our frequently asked questions section of the website. And just to give you a sort of a snapshot of where we are today, for claims that were submitted prior to May 20th, 2020, those claims are currently receiving award decisions. Now, claims submitted prior to June 2020 are currently in substantive review, which is the step before receiving award decisions. So just please keep that in mind. If at any point you have questions, again, certainly you can call the helpline, but that'll give you a sense of where we are in the claim review process. Okay. With that, I am going to pass it back to Nicole, who's going to just provide some concluding remarks before we open it up for your questions. Thank you.
Thank you, Anthony.
And I'll
So
advance
as we
slide
wrap
forward.
up, okay, thanks a lot. So as we wrap up, we want to leave you with our top 5 takeaways. So first, we want to encourage you, register now. You can do it online or by phone. There's no reason not to. If you answered yes to that question, where were you or were you there? Even if you are not sick, you should go ahead and register. It's better to register than not and risk missing a deadline. And like I said earlier, if you're not sure, if you already have registered, call our helpline to check your registration status. Number two, we want you to get certified by the World Trade Center Health Program before you file your claim. The deadline to file a claim is the same for everyone. It's October 1st, 2090. And you need to get certified before you can file your claim with the VCF. Number three, the members that are on the phone, UPOA, or in this Zoom, you should contact the union to discuss documents that can help prove your presence. Again, that email address is unitedprobation@gmail.com, UNITEDPROBATION@gmail.com, or you can call the union at 212-226-1069. Again, that's 212-226-1069. And then number four, everyone who is eligible qualifies for a non-economic loss award after offsets. There's no additional proof of loss needed. And then number five, you do not need an attorney to file a claim. It is, of course, your decision. If you would like to use an attorney, our helpline is here to help. If you do use an attorney, you should know that by law, your attorney is limited to 10% of your award for fees. And with that, we're going to leave you with some resources. Our website is the best place, www.vcf.gov. It is a government website. You want to make sure that you're actually on our official website. And the way that you can tell that is you see at the top of the right, there's a little lock icon. You'll see that. You'll also see the little American flag that says next to it, an official website of the United States government. That's how you'll know that you're actually on our website. There are some websites out there that kind of mimic ours, but you want to make sure you actually are at the .gov website. We have a lot of general information. We have our forms and resources. We have frequently asked questions, how-to guides, our policies and procedures, and much more. This information is available in 4 languages, including English, Spanish, Polish, and Chinese. Our helpline is also a great resource. We are open from Monday through Friday, 8:30 a.m. to 5 p.m., except federal holidays. They're always there to help. They will help you walk through the claim form. Any issues that you run into with your online claim, you can call, they'll help you. That phone number, for those of you on the phone, is 1-855-885-1555. Again, our toll-free helpline is 1-855-885-1555. We also have a number for the hearing impaired. If you need to call the hearing impaired number, it's 1-855-885-1558. So it's the same number as the main helpline, but the last digit is an 8. And then if you're calling from outside the US, you can call 202-514-1100. We do have interpreters available. We also have bilingual agents that are there. So it doesn't matter what language you speak, we can get someone on the phone to help with your call. And then Anthony would not be happy with me if I forgot to remind you guys to follow us on Twitter. We recently joined Twitter a couple months ago. It's at Sept11 VCF. So that's at SEPT11 VCF. So those are the resources. That is all that we have for our presentation today. I want to thank again our partners at Mount Sinai, and also the UPOA union. So I think we're going to open it up for some questions, but I do want to put out a quick disclaimer that we cannot answer any claim-specific questions due to privacy, and also how specific your individual circumstances may be. But if you have any claim-specific questions, you can, of course, call our helpline and they'll help you out. So that's all we have. Do we have any questions? Okay.
So that 2090, when they calculate, it was a calculation based on, they figured that's how many people it might affect in the long run. That was I don't know if I'm saying this right. That might have been affected, that might have been present, but they didn't have anything that showed that they didn't get sick or anything later on. Am I saying that right? Because it says 90. I'm trying to understand how they come to.
Delvani is referring to the World Trade and Health Program and its services available extended till 2090.
Yeah.
So that had to do with the fact that, as I mentioned, and Nicole and Anthony, please fill in here as well. That has to do with the fact that, as I mentioned, the World Trade and Health Program is available to offer services to any 9/11 worker, volunteer, general responders, but also to anyone who was at that time present at the site or surrounding location south of Canal Street, right? That includes a lot of kids, a lot of children, a lot of daycare children.
Yes,
so
right.
They took the life expectancy and they calculated and they, sort of settle on 2090.
Okay. I figured it.
Yeah. I don't have anything to add. That covers it. Yeah.
If just as a reminder, please use the QA feature that is in your Zoom. If you are using this, please make sure to select all panelists and attendees so we can see the question. But I don't have anything.
Looks like there's a hand raise.
There was a hand raise, yes. If you raised your hand, do you mind putting your question in the chat box in the QA section? I don't see, do you guys see the question? I don't see any other questions.
I don't see it.
Give it a few more minutes. While we're waiting, Nicole and Anthony, I know with some of our patients, one of the questions that do come up are sort of the death claims as to, my husband responded to 9/11. I don't know whether or not he did file a VCF. How do I start? Can you talk briefly about some of the death claims for responders and survivors? How, what's the process? How to start that?
Okay. So if someone is trying to figure out whether their loved one or their spouse had a claim with the VCF, I would say call the helpline. That's the best place to start. We do have to have a personal representative that has been, granted. They have to have letters of administration or some other official documentation from a court, like a court order, giving us permission to discuss that claim with that individual. And so their wrongful death claims are pretty, it depends on the circumstances. It depends on whether the person died as a result of their 9/11 related illness or if they died from another cause, to determine what information we will need to process the claim. But the first place to start would be to call the helpline. We can go from there. They'll let you know like what you need to submit and what information we need to move forward.
I don't see any additional questions, but I know those come up very often. So I'm going to ask 2 more questions.
Okay.
If we don't have anything in the Q&A chat, and we'll wait for maybe people to type up. One of the questions that we do get very often from some of our responders is, can I change a law firm or can I change an attorney? I'm not satisfied with the attorney that is working on my VCF case. We are in the middle of applying. Can I go ahead and change that?
Yes. If someone decides that they would like to use an attorney to file their VCF claim, they are absolutely able to switch attorney representation. We have a form on our website, the change of attorney form, request form that they would have to complete and submit to us, and then we'll take it from there.
Okay. The last question that comes up very often with our responders also is, and maybe that would be beneficial to the probation officers here, is how to amend the claim. So I was awarded a certain amount of money for those conditions. As a result of that, I developed some additional conditions that were certified by the World Trade Center Health Program. How do I go about amending the claim, and when should I do that?
Okay. So if someone has been certified for a condition and they filed a claim, we've paid the claim, and then later on they're certified for additional conditions, they can definitely come back and amend their claim. We do always want to remind people that it's not the number of conditions that you have certified, but the severity and the impact on your life. And so if you've been certified for, say, like asthma, and you've been paid for your asthma, but then you come back and you are unfortunately certified for a cancer, then, you know, it's more likely than not that your award will increase based on that cancer, because we pay out higher awards for cancer. If it's something like you've already been paid for asthma and you come back and now you have COPD, it's a similar aerodigestive condition, and you may still have the same type of, I don't know, that might be a bad example, but you may have the same type of effects on your daily life. And so you now have two conditions, but your severity hasn't increased because of that additional certification. So your award may not change. So we just want people to understand that it's the severity and the impacts on your life that dictates the amount of your award, not the number of conditions that you're certified for. Yeah, and you can file an amendment online. So if you go into your online claim, there are steps that you can take to file your amendment online. Yeah, and if you have, of course, any questions, call the helpline and they can help you.
Great, thank you. Delvani, I don't see any additional questions, anything from you, or we will have that available. So we'll send you that recording and possibly the slides as well. So we'll send that over to you so you can post it on the website as well.
So I just want to thank you all for sharing this information with us, and it was very, very helpful. I know it was very helpful for me. So if there's any question, let me ask you a question. If there's, after it's posted and other members have questions, how do we go about reaching out to you? Or do I share those gather questions and share them with you, or should they contact the office?
Yeah, I think for us, Delvini, for the VCF, just direct them to our helpline, our toll-free helpline.
Okay, that's what I'll do. All right, so I don't want to be the middleman. All right, so thank you. I don't have nobody said something. I want to thank you.
We understand.
And happy Memorial Day and a good summer.
Be safe, everyone.
Same to
Thank you
you.
so
Thanks
much.
again.
Okay, thank you.
All right, take care. Thank you.
Take care, everybody. Thanks again.